Good morning, everyone. My name is Ahmad Al-Qadi. I work as an advocacy officer for Justice for All Canada. I'd like to begin this press conference by acknowledging that in Ottawa, we are on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation, whose presence here reaches back to time immemorial. We also recognize the Algonquins as the customary keepers and defenders of the Ottawa River watershed and its tributaries. We honor their long history of welcoming many nations to this beautiful territory and uphold and uplift the values and voice of our host nation. Moving forward, what have we been witnessing this month that cannot be categorized as a genocide or as genocidal? We have seen the indiscriminate murder of civilians. Now over 14,000 killed civilians, among them more than 5,000 children, over 4,000 women also killed, and among them 60 killed journalists. What's just as important is the fact that 500,000 people have been displaced from their homes, from nowhere to go, and no hope to return to their destroyed homes. In a month and a half, this has happened. And how can this not be described as genocidal? So after so much senseless killing and displacement of innocent civilians, we will stand unabashed, unreserved, and unafraid to make this claim. It is the cold, hard truth. Today, we're merely echoing the voices of tomorrow when we as a nation, and specifically our leaders, look back on this and say, we should have never let this happen, that they regret letting this happen, and say the famous words, never again. And these words that carry meaning, that should carry meaning, but mean little to our government, clearly, because they have allowed this to happen. They have not worked with international partners to secure an immediate ceasefire. And right now, as a nation, we can continue to either let this happen, ignore the fact that we are witnessing a genocide unfold right before our eyes and allow further civilians to be murdered, or we can accept it and work towards a path of justice and peace. These weeks, we have seen horrible images of children so severely wounded by bombs and explosives that their flesh has been torn from their bodies and their bones are visible. And this is courtesy of the indiscriminate, violent campaign of bombing brought to you by the Israeli government. What's worse is that the medical situation in Gaza right now is an absolute crisis. In northern Gaza, every single hospital has been rendered completely inserviceable. They're out of service. They cannot operate. Amputations and surgeries that need to happen as an emergency are done without anesthesia, without any medical supplies, because there's no medical supplies available. And if we think that just because right now there is a 4-day truce that people will not continue to be killed, that is false. Let's remember that people are starving. They are starving to death. They are dying of thirst. They have no fuel. They have no electricity. And that blood is on the Israeli government's hands and the hands of our government. But nonetheless, we have 4 precious days. And in these days, we have to urge our government. We must urge our government to work with its international partners tirelessly to ensure that, number one, we can reach an immediate and permanent ceasefire to end the senseless violence and end the killing of civilians and the killing of children. And as well, our government has to work with its international partners in securing desperately needed medical supplies to the people of Gaza. We cannot allow this to continue. We cannot keep watching people be bombed with no hospital to go to. Today, you'll be hearing from representatives of the Indigenous and medical community of Canada to stress this absolute necessity for our government to take the humane, logical, and only approach to ending the violence against the Palestinians in Gaza and the murder of innocent civilians. So now I will invite Gabrielle Fayant from the Assembly of 7 Generations to deliver her remarks. Thank you, Gabrielle.
Tanse, Gabi Nitsagason, Pakjahanse Otsania. Hello, everyone. My name is Gabrielle Fayant. My family is from Fishing Lake, Métis Settlement, and I am here on behalf of the Assembly of 7 Generations, or also known as A7G. We are an Indigenous youth organization who are supporting Indigenous youth through many capacities and struggles, including addressing the intergenerational impacts of residential schools, revitalizing cultures and traditions that were stolen from us, and navigating systemic barriers and violence that target Indigenous youth and children to this day. The world has witnessed a relentless and brutal bombardment by the Israeli government on unarmed Palestinian civilians, including babies, children, women, and even hospital patients for over 6 weeks. Children and youth have been forced to become journalists, advocates, and martyrs, experiencing more trauma than any human should have to endure in their lifetime. I stand here with Palestine because I feel that I have a moral obligation to speak up and stand up for injustice, especially when children are being murdered in the thousands. Indigenous peoples are seeing stark similarities in the colonial tactics being used against Palestinians that we've experienced here in Canada. From water and food being withheld, to uprooting and the destruction of our traditional plants and medicines, to the pass system and identification cards. For over a century, Indigenous children and youth have undergone genocide at the hands of the Canadian government. The residential school policy is the most well-known and documented horror committed against Indigenous children. Canada and churches committed genocide against Indigenous people for decades. For over a century, Canada denied this fact. Canadians who were devastated upon discovering the unmarked graves at residential schools and said they would have done something if they had known are now in a position to act and intervene in a genocide. The Canadian government and Western countries bear responsibility for brutal killings of Palestinians, directly funding Israel, trading military gear, weapons, and aircraft to Israel, and censoring and silencing Palestinian voices in the media. We urge the public to remember that 1, a temporary ceasefire will not stop a genocide. A permanent ceasefire is required. 2, the medical and humanitarian catastrophe will have irreversible effects for decades to come. Palestinians who have not died from direct impact are still fighting through starvation and disease. 3, Canada has an international legal obligation under the UN Convention of the Prevention and Punishment of the Crime of Genocide, the UN Convention on the Rights of the Child, and the UN International Covenant on Civil and Political Rights, and other international conventions. We call on all Canadians to continue their pressure on all levels of government, to continue divesting from companies that are funding this genocide, to continue sharing the truth about what is happening to Palestinian people with their networks, advocates who will stand firm in their calls for peace, justice, and humanity are needed now more than ever in the face of seeing killings and brutality and greed. Exe, ai, thanks for having me.
Thank you, Gabriella. My name is Dr. Kareem Habib. I'm the medical director at One Health Clinic .online. Ladies and gentlemen, today I address you with a heavy heart and plead for urgent attention to the humanitarian crisis and genocide unfolding in Gaza. The images of suffering and destruction are not distant scenes. They're stark reality that demands our collective empathy and action. As a nation that values peace, justice, and human rights, it's our duty to stand up against the atrocities occurring in Gaza. Innocent civilians, including children, are facing unimaginable hardships, caught in the crossfire of conflict. The humanitarian crisis is worsening day by day with limited access to essential food, water, and medical care. Canada has a proud history of advocating for peace and diplomacy on the global stage. Now, more than ever, we must leverage our diplomatic influence to call for a sustained ceasefire in Gaza. We cannot turn a blind eye to the suffering of innocent civilians, and we must use our voice to encourage international dialogue for a lasting resolution in the region. Furthermore, our government must intensify its commitment to providing humanitarian aid to the affected people of Gaza. Our assistance can make a tangible difference in alleviating the suffering of civilians who have been the primary victims of this horrific aggression. Canada has a tradition of compassion, and it's imperative that we extend our support to those in dire need. In time of crisis, the world looks to nations like Canada to be a beacon of hope and a champion for peace. We must not shy away from our responsibility to advocate for the protection of human rights and the well-being of individuals, regardless of their geographical location. As we deliberate on our role in responding to the situation in Gaza, let us remember the values that define us as Canadians: compassion, empathy, and a commitment to justice. It is in these values that define us as Canadians: compassion, empathy, and a commitment to justice. It's in these moments that our actions will echo across borders, demonstrate our dedication to a world where peace triumphs over violence and the well-being of humanity takes precedence. I implore you, each and every one of you, to consider the urgency of the situation there and to use your influence to make a positive impact. Together as representatives of a compassionate nation, we can contribute to the alleviation of suffering and work towards a more peaceful world. Thank you.
Good morning. My name is Dr. Fahamia Kudra. I am here as a physician representing the Canadian Healthcare Worker Alliance for Gaza and as a board member of Human Concern International. I start with a quote from a courageous human being. And if I go, who treats my patients? You think I went to medical school for 14 years so I can only think about my life and not my patients? This is not the reason I went to medical school and became a doctor. These were the last words of Dr. Hammam conveyed before he was killed by an Israeli airstrike near Al-Shifa Hospital on November 11, 2023. This is how thousands of Canadian physicians feel. We took an oath to save lives. Our main concern today is about saving the lives of many innocent civilians, casualties in both sides of this conflict. Today, I stand before you to discuss the dire humanitarian and medical situation in Gaza amid a backdrop of conflict and suffering. A 4-day humanitarian truce is a temporary pause in a devastating conflict that requires a permanent and continuous ceasefire to truly save lives in Gaza, West Bank, and in Israel. As of yesterday, a staggering 14,532 Palestinians were killed, including 6,000 children and 4,000 women. Over 35,000 injured and at least 6,800 missing. Each hour, Gaza witnesses 15 killed by bombardment and the destruction of 12 buildings. These are not just numbers. 1.7 million are internally displaced. Winter is coming, and there is no sanitation or water. Respiratory disease and gastroenteritis outbreaks, vaccine-preventable disease are rising. No access to IV fluid or anesthesia. People are dying from starvation and dehydration. A 4-day pause is not even enough to retrieve bodies from the rubble. Without a ceasefire, mass casualties will exponentially increase without the desperately needed supplies and the devastated infrastructure. Our current aid delivery situation is critical at the Rafah border. Over 400 aid trucks are waiting at the border, constrained by restrictions excluding fuel, essential for operating the hospitals, medical centers, and sanitation facilities. Amid this chaos, our humanitarian workers striving to deliver aid over the last 14 days face immense challenges, such as the trauma of personal loss, with many having lost family members and colleagues. Though two small hospitals in the north of Gaza, one in the city of Gaza and another in Beit Lahia, are estimated to be partially operational and admit patients. The remaining 22 are out of service. Of the 11 medical facilities in the south, 7 are currently functional. Only a fraction of hospitals are operational, with the bed capacity reduced from 3,500 to 1,400. During the upcoming 4-day pause, our teams will be focused on delivering aid to the most vulnerable, such as the children, the women, the disabled, and the seniors. In Canada, many Palestinian Canadians have family remaining in Gaza. They are left without clear answers on safe evacuation. Healthcare workers and grassroots teams in Canada are working countless hours providing free medical support to civilians and health allies in Gaza, as well as to the devastated families here in Canada. HCI and the Canadian Health Care Work Alliance for Gaza are calling for a decisive action from the government. We make a heartfelt request to His Honorable Prime Minister Trudeau to advocate for a permanent and definitive ceasefire, the opening of a humanitarian corridor, the protection of hospital staff, patients, and civilians from bombardment, condemnation of the indiscriminated destruction of healthcare infrastructure in Gaza, and respect for freedom of expression and safety of healthcare professionals and students voicing concerns for Palestinians in the workplaces. Thank you.